This is One-on-One. We are pleased to be joined by our friend Dr. Serra, who is the chairperson of the Division of Nursing at Bloomfield College. Good to see you, Dr. Serra.
Thank you. Thank you.
Doctor, talk to us about nursing. I mean, you were saying right before we got on the air that nursing has changed a lot since the Affordable Care Act. In what ways has it changed?
Well, it has been changing dramatically, but the Affordable Care Act is giving more opportunity to advanced practice nurses to really practice at the full extent of their education.
Take a step back. You use the phrase advanced practice nurses.
Yes.
I think people watching say, well, what's the difference between an advanced practice nurse and a nurse? What's the difference?
Well, to be a nurse, you need a degree. It's either a 2-year or now, more importantly, it's a 4-year degree to become a registered nurse. Before you can sit for licensing,
right,
you have to have that kind of education. So an advanced practice nurse is that they go beyond that and they study at the master's level and at the doctoral level.
They can do more?
They can do more.
Does that impact the patient differently?
It impacts the patient in that a lot of research has been done as to how effective they are. And actually, because nurses are trained differently than doctors, they're not doctors, but they can practice and
Sure.
do certain kinds of care for clients. And many of them work in inner cities and in areas where it's the accessibility to MDs
Sure.
is not there. So.
And you know the other part of that that's so important, doctor, is that prevention, the prevention piece. You know, so much focus in healthcare is dealing with acute situations, but more and more the role of nursing, the role of nurses, focuses on prevention. So give us a concrete example. We were talking about asthma right before we got on the air. So how would a nurse or those in the nursing profession deal with someone with asthma from a prevention point of view versus, all right, we'll wait until it's an acute situation? What's the difference?
Asthma is a chronic condition. You're not going to be cured of asthma. Okay, so you have to learn, there is no cure at this point. So you have to learn how to live with it and how to manage it effectively so that you don't end up using emergency care, which is very, very expensive. So nurses...
Which is part of the problem.
Right. Nurses in general, their focus has always been on educating families, educating patients on what they can do to try to prevent these conditions from exacerbating.
Let's talk about asthma a little bit. What people watching right now, they either are dealing with asthma, they know someone dealing with asthma, family member, whatever. Educate them right now. What could they do?
Okay. They can, first of all, they have to make sure that they're using their, if they have peak flow meters or whatever it is to detect if they're going into an exacerbation of their asthma, okay? So they can learn things to do, like, for example, in the home, how to try to keep it, you can't keep a totally dust-free environment, but how to manage the home so that you minimize the amount of dust and pollens that are there.
How about smoking?
Smoking is another big one.
Off limits.
It should be off limits to everybody, and there's a lot of legislation now that has come into effect about no smoking in certain areas, so that also has helped. But patients that have asthma, like I said, have to learn how to live with it and manage it effectively so that they don't end up, I mean, literally, people can die of asthma.
But what's the role of nursing in all that, though?
Nursing is education and management. That's the main role of nursing, teaching families what to do, teaching families how to take care of the family member or themselves if they have asthma, how to avoid things that they know may trigger an attack, how to, if, for example, if you're an athlete, let's say, in school, and you know that exercise, excessive exercise, will trigger an asthmatic attack, we'll teach them what to do before. Maybe they need to take the inhaler before they go into exercises.
But here's what's so interesting about it. I keep thinking, doctor, that actually the education of nurses today, the training of nurses today, sounds like it has to be somewhat different because of the role of nurses.
It is different because there is so much more nurses have to learn and do as opposed to when I first became a nurse. It's very different. People live longer. Diseases are not more prevalent, but they tend to show up sooner, and many people don't know how to deal with their conditions or try to avoid. Just because you have a predisposition to a disease doesn't mean that you're going to get it. So if you know that you're predisposed because of family history or whatever, so you have to learn how to try to avoid getting it, especially early, and how to effectively deal with it once you do have that condition.
You've been in this industry, this profession for a few years.
Yes.
How would you describe this as a time to go into nursing? Good time?
I think it's a wonderful time to go into nursing. Make the case for nursing.
Yeah.
Because, again, our population is aging. And as we all know, more and more acute care hospitals can't manage to have patients there for days and days and days. So people have to learn how to take care of family members when they go home. So this is where community nursing is really out there. Nurses teaching families how to take care of someone who has. When my mother was
a few seconds you're going to tell me off the air, but they're more important than ever before.
More important.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, New Jersey Resources, Sovereign Health System, Oscar Health Insurance, NJM, ADP, and by the Fidelco Group. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.